as Nigeria marks its 64th independent anniversary. Now, the nation's healthcare system remains a critical topic of discussion. Now, despite the reforms and the huge sum that the government has been pumping into the health sector, there seems to be a disconnection between the recipient and the providers. There seems to be a serious disconnection. Now, today we are going to be exploring the current state of our healthcare system, how we can access affordable healthcare. And we have with us an occupational therapist who will be talking to us along that line. She's in person of Honorable Victoria Omua Amu. Good morning and good to have you.
How are you today?
I'm fine, thank you.
So nice to be here.
Good
morning, viewers.
All right, walk us through. How would you assess Nigeria's healthcare system and how has it fared for the past 64 years?
Nigeria healthcare system has been staggering. Some gains, a lot of losses. Some gaps, yes, a lot of gaps. When you talk about healthcare system, you talk about its affordability to the community, the persons who are actually going to benefit from the healthcare system. And when you think about healthcare system, you think about universal healthcare system coverage. Can we boastfully say Nigerian citizens have universal healthcare system? No. Can we say there's a reduction in out-of-pocket expenses where it comes to healthcare? No, we can't. So those gaps still linger. There's a disparity between the urban and the rural area. Those in the urban areas, because it's an elitist environment where the high is high, the low is low. You know, the elites are able to afford healthcare. The low-income earners will not resort to healthcare, will not seek out healthcare until they are in a critical or dying stage because of the out-of-pocket expenses. Do we have policies that should take care of those kind of out-of-pocket expenses?
That's a big question.
Yes. And are they implemented as needed? A lot of gaps, you know. So at 64, we would think that Nigeria itself would be at a point where for healthcare coverage, if like other countries, developed countries, they don't have social security amenities for people, they just have instances where they give out money, you know, 10,000, 5,000. Then you want to look at healthcare. How is healthcare helping to decrease mortality rates for women pregnant? How is healthcare reducing death rates in the country? How are people within the country living longer or their lifespan is shorter? So the healthcare, and when you nose drive, you find out that if you call your brother today and you say, your brother calls you today and say, I have a headache, or I'm feeling dizzy, or I didn't go to work yesterday because I had some issues. I went to work, I was feeling, I was sweating. Okay, let's do that. I was sweating. So you say, what did you do? You say, did you go to the hospital? What is the first response? No, hospital care. I didn't go to the hospital. I went to the chemist.
So you're now saying Nigerians are not taking their health seriously?
I'm saying that the orientation to approach healthcare facilities is very low. And it is low as a result of the healthcare, the out-of-pocket expenses that families bear. The cost of food is high. Cost of living is high. You have children in school. Then someone says they are sick, and you get to the hospital and the doctor tells you, oh, you need to pay 100,000 before we admit this person. The best thing is to go to the pharmacy, and then the pharmacist will, as usual, tell them that they have malaria, they have typhoid. And then they start treating the symptoms of the things that, while the underlying diagnosis and the underlying disease is still there, yes, nothing is taking that away. And that has not been diagnosed. There is no blood work, there's nothing that has been able to help put the person in in the direction that they need to be. And that's what is called preventive health. That is not yet available. The awareness for that is not in the country.
Some stakeholders are saying that until the politicians patronize or assess our healthcare system in the country, the healthcare system will not improve. For instance, in Aso Rock, we have one of the best hospitals there. The previous administration invested a lot. Successive administrations have been investing a lot to ensure that we have stable healthcare. For instance, in Aso Rock, we have a president who doesn't use the presidential clinic. When they have issues, they jet out. And if you break it down to the grassroots, we have state governors who don't even assess the state-owned hospitals. So some stakeholders are of the opinion that until Nigerian politicians patronizes the healthcare system in the country, it won't go anywhere. Do you agree with that?
They should. That's the first rule of the term. They should, but even as they should patronize the country's healthcare hospitals and the facilities we have, they also have their choice. And their choice has never stemmed into them patronizing Nigerian-made stuff or Nigerian facilities. Why? Because we're talking about healthcare. Education is we are dealing
with healthcare.
On the nose. When I speak education, the doctors that will treat you must be properly educated.
Definitely.
So when you talk about the gaps in education, you talk about training of medical personnel. Is it by seasoned trainers? Is it by persons who invested time? Do they have facilities where they actually train? I'm talking about the doctors that actually are in the facilities. I'm talking about like the occupational therapists like myself. I'm talking about the physiotherapists that are there. I'm talking about the nurses. Do we have adequate numbers? Is the workforce.
Could that be the reasons why we don't have politicians, those in power, patronizing our hospitals?
Because I think, I'm not right. I would patronize Nigeria Hospital, and I do that.
Okay.
I feel they do not trust the hands that they are going to put their lives in. And that's why you have a lot of Japa syndrome, where professionals actually leave the country because you graduate, you won't find a job. You must be a politician's son or a politician's relative for you to find a job. And you might be very good at the work you do. Then you go and hire a politician's son or a politician relatives who have very little knowledge of the actual profession that they have studied. And then you have that boomerang, and your family member goes to the hospital and they just tell you it's a common surgery, and the person dies from there. When I was in school, I'm just going to digress to give you a preview into how I live my life, and how when we were in school, my professor used to be so hard on us. You know, we had other departments, you know, they used to be able to pass with a D. My professor said, no, you must have A or B. You know, I studied in the US. You must have A or B. If you have B 2 times, the 3rd time will boot you out of the program. And that's how the program has...
Automatically.
That's how they tell you, go take another major, go take another profession. So when we graduated, we usually have graduates, and when you see OTs everywhere, they love dancing. So there was this music, and he said, ask your questions. And we said, why are you in this faculty so hard on us? Why do you demand so much on us? He said, 1, you are black. 2, you have an accent. 3, every day of your life, you must demonstrate your skill. Then 4th one, if your mother or your family member goes to see a neurologist that only knows 30% of the brain, or 40% to get a pass, will you actually put your parents down and say this neurologist should actually do the surgery? What if the part he knows is the good part in your parents' head, in your parents' body, and he doesn't know the other part because he scored only 40% and they passed him? He scored only 50%. So when we talk about healthcare, we talk about education, we talk about the kind of hands we have and we talk about what the government is actually doing to sustain them in the system, to help healthcare grow. When I watch television, I see, oh, we provided 100 beds, we provided this, we provided that for facilities, but the people who are coming to patronize it, do you have health insurance for them to actually come in without out-of-pocket expenses? No. Health insurance is only for civil servants.
Okay.
The National Healthcare Insurance has not made provision for people outside civil servants to be able to...
So those who are not in civil service, they're actually cut out.
They are actually cut out.
And it's not like that in other clients.
No, it's not like that in other. You are able to access health care. You are able to access health insurance. You are able to, they have a platform where you actually will come in based on your income. You either get free health care or you pay some money back. You know, what you have for even the civil servants in Nigeria today, the NHIS, which has trickled down to Edo is you buy the insurance and then you get your 90% of your hospital bill is paid. You only have 10% out of pocket expenses. That means if you are a woman who is pregnant and you are about to deliver and they say it's C-section and the doctor says it's 300,000, you only have out of pocket expense of 30,000. You don't have to now be going to church and be praying and be saying, God, change it, and the woman dies in the process of not having enough money to access health care, and because of that lack of money and no insurance, the person dies.
To an extent, Edo State government, under the leadership of Governor Godwin Obaseki, is actually doing well in this light. The Edo Hills is accessible, whether you are a civil servant or not. In as much as you subscribe to it, to an extent, you have affordable health care. But what are the major barriers bridging the gap between the rural areas and the urban setting?
Information.
Okay.
Information, yes, you just said Governor Obaseki did a lot of things. He did Edo Hills, yes. And the beauty of Edo Hills on its own as an agency is that Edo Hills has the ability for individuals to come in and buy and subscribe. But do you have individuals coming in and subscribing? No, you don't. You know, Edo Hills has different levels of health insurance scheme, which is you have the one for 18,000, you have the one for 35,000 a year, you have the one for I think 40-something thousand or 50-something thousand, and you have the gold, the platinum, that is 75,000 naira. You know, so what does that mean? That means that if I, an elite who is not a government worker or high income earner who is not a government worker, who works in a private organization, and the private organization doesn't have health insurance for us, am I able to take my money and go and purchase the insurance and be able to access hospitals close to my house? Because that's the essence of it. But when you look at those in the rural areas, they don't have such accessibilities. Do we have persons in the communities who my brother has always been coming to me, calling me, my wife is always sick, we have gone to the hospital, my mother is sick, we have gone to the hospital. Have I ever, as an individual, thought, say, okay, this person is always visiting hospital, let me go get health insurance for we are not at that level.
We've not gotten there.
Do we also have politicians, instead of giving rice, giving beans, giving tomatoes, do we have them say, okay, every year when I'm celebrating my birthday, I'm going to purchase a bulk of insurance, you know, even if it's the 18,000 one, you know, I'm going to purchase for 50 people. I'm going to give it out to 50 people. Then nose dive, let's trickle down back. You are a big man, you live in your house, you have your megad, you have your driver, you have your this thing.
How many of them have you subscribed to?
And many of them have
health insurance.
So yes, it's until persons start to make, especially people who walk around them, who live with them, people who make sure, babysitters, who make sure you can travel to Japan and go and do your business and they are caring for your children. Have you ever thought about giving them a health insurance scheme where they will actually be able to access hospital? They wouldn't be calling you from Japan and say, Madam, I'm not well, oh, I have to go to the hospital. The bill is this, or my mother is not well. So it's until we are proactive. We are proactive as citizens.
Okay.
That's when we can complement what government is doing. And that's when we can also demand from government that you are not doing right.
We are still discussing with Mrs. Amu Omua, who is an occupational therapist. And of course, she's been doing well with the discussion. Let's get now to you now. How effective has the National Insurance Scheme, NHIS, how have they been faring in achieving the universal health coverage?
A lot of gaps, a lot of complaints. Most people who have the National Health Insurance Scheme from the federal, because the national is the federal, complain that even when they assess the hospitals, that the hospitals are insufficient, that the hospitals, because they ask them to pay 10% this thing, the kind of generic medication they give them is the problem. You know, the generic medication is the bottom level of all the levels of the medication. They do not get actual medication, actual brands. They do not get name brand medications. Then you also find that some complain that the private hospitals sometimes are not the best. So those are the gaps. But you know, as government, part of the healthcare, part of the healthcare ministry is also to have people who actually go into the hospitals, hospital management, who actually go into the hospitals, to both private and state, to ascertain if the quality of care is actually does it actually meet the
standard?
The standard, you know. And you know, Nigerians being what they are, they cut corners everywhere, you know. People take their jobs the way they see it, you know. If you talk too much, that private hospital owner can be the brother, the senior brother to your MD, can be the senior brother to your governor, you know. If you, the person who is actually now watching to see if they've done the right thing, is the one complaining, you're going to lose your job. So all those standards needs to be met in order for health. Then when we go into rural areas, like the Edo Hills is supposed to have affiliations with the primary healthcare centers in the rural area, have affiliation with the private hospitals in the rural area. I know that the Edo Hills is doing, the Ministry of Health, Edo State, is doing everything in its power to go and regulate those private centers to make sure that they are up to standards. And that's what we should do. But it requires funding, you know, for you to send a team from Edo State, from Benin, for you to send a team to a rural, to like Irua, to, you know, for you to send a team to Auchi, you know, to go and look at standardization, is also money consuming. So is money available for such things? Because when money is available for such things, are you hiring? Do we have enough doctors? Do we have enough nurses? Do we have enough rehabilitation therapists, OT and PT in the system? So those are the things that make universal coverage and make healthcare progressive. But those things have so much gap. And over the years, it seems like it's getting worse. You know, at the beginning of the year, we just hear budgets. The budget for healthcare is so. And then that's all.
Such budget is not utilized.
Well, it's utilized to the level at which they can get the money. If you don't get money, are you going to use stones or saliva?
Okay.
You want to do that. So if the money is accessible to them, to the ministries, the ministry will be able to carry out the task that it has before it. But you find out sometimes January, by the time the money is accessible, it's already October, you know, fourth quarter.
We seem to have so many primary health care centers in our rural areas that is empty. Empty in the sense that you don't find medical doctors there. Even nurses posted there, they don't even stay at their duty post. There are cases where you have a federal hospital going into partnership with local, some certain local government, sending manpower there. But some of this manpower sent there, they go ahead to have their own private ventures instead of taking care of their primary place of assignment. How do we bridge that gap? Where you have a medical doctor who is sent to a local government or a particular setting to take care of the primary healthcare center there, running his personal business. Couldn't that be one of the reasons why we are not progressing health-wise?
No. You have clustered a lot of things together.
Yes, together.
Yes, you have clustered a lot of things.
So should we separate them?
Yes, we should separate them.
Okay.
From the first one you said, which is what?
Where you have a federal parastatal, for example, a federal hospital,
yes,
going into partnership with local government, sending
yes,
manpower there.
Yes.
And at the end of the day, you don't find the people who are sent there.
You can't find them because probably they live out, they do not live in those local governments. I will give you an example of the US. They used to have a problem where police officers, the white police officers that were sent into the black neighborhoods used to kill the black. So they reshuffled, they went into the meeting, strategic meeting, and said, okay, we will leave blacks in their neighborhood. We will leave people, you can't live in, where are we now? You are in Uluku. You can't live in Ugbo. Or yes, you can't live in Ugbo and be coming to work in Uluku. You understand
that
what
will stress you.
That will stress you.
But in federal system, in federal civil service, there's what they call rural posting allowance.
Yes,
there are allowances.
Yes, that is.
So if you are taken to a rural setting to an extent, you should have an allowance.
Yes.
That covers it.
That covers your stay.
Yes.
Yes, you should have an allowance. Your accommodation will be taken care of.
Definitely.
But we need to also know who are those you are sending. Do they have the actual enablement to work in that system? You send a doctor in, the hospital does not have a laboratory. Does not have a laboratory. So how will a doctor carry out, you come in and you say, I have headache, I have dizziness, he wants to run blood, he will still send you to a private laboratory.
To run some tests.
To run some tests. And then if that doctor is proficient and everybody knows he's good at his job, and the doctor now sees that it's only private hospital, the actual hospital that I am serving, that I'm a civil servant I'm working with, has refused to buy diagnostic equipment, has refused to send laboratory technicians, scientists, yes, there to the place. So is it the same doctor that will do the lab and will do the diagnostic check? Where will he do the diagnostic check? So those are the gaps that we live in as government, where people now resort to their own private self-help. Because if you as a doctor or as a clinician that is in there, see that every day you have an influx of 50 people and you refer these 50 people to this particular diagnostic, and it takes very little for the ministry to procure diagnostic check in this thing, to hire or to send one of his lab scientists to that area, and they refuse to do that, and you are there. So most times people resort to self-help, because when you write, nobody listens to you. And then
by running their personal
by running
facilities.
their personal side thing, because in their personal side kick, they understand what you need to run a hospital. The ministry or the government itself that has these different hospitals understand what they need, but they have ascribed the money for health into other areas. And then the second one to your question, why are people not coming into this place? Lack of awareness, no money to pay. Because when you come into primary healthcare center, they make you pay. It's not free. Is it free?
In a way, it's primary healthcare center. Is it free? It's supposed to be.
It's supposed to be free. It's supposed to be free, but the running cost of handling the place, it must be able to generate income for itself. It must, the facility must be able to generate income. And the facility generating income, the people in the rural areas most times can't afford it. And we are back again to health insurance. If you have health insurance, you don't need to pay out of the pocket. You don't even need to pay for card. Do you understand?
Yeah.
You don't even need to pay for card. Where you go to some hospital, they say it's 5,000 naira for card. You don't need to pay for card. You just walk in, give them your ID, they put it down, they tell you to see doctor. If consultation that day is 10,000, you pay 1,000. If you have to run labs, if a lab is 5,000, you pay 500. You know, so that's also why you have very few people going to hospitals or accessing healthcare. They would rather go to the pharmacy, the chemist, and say, it be like say something they do this. But the downside of this is that if your glucose level is already high, that pharmacist does not have any kit to be able to tell you, your glucose level is high, does not have any kit to tell you, I took your blood pressure. Your blood pressure is over the normal blood pressure, which is 120/80. Your blood pressure is 145. What happened? You know, the pharmacy will just tell you, the chemist, not pharmacy, because licensed pharmacists know what they do. You know, when you make a certain complaint, they refer you to the doctor. Yes, licensed pharmacists know that. But the chemist will say, go and buy what is that thing that we use for P-Alaxin, for malaria? Buy blood medicine. I think blood is low. That's why you are feeling dizzy. But those are underlying effects.
But to an extent, in all these communities, the
Yes.
only thing you find there is chemists. You hardly even find standard pharmacy there.
Where I come from in our West, we have standard pharmacy. We have private hospitals.
Yes.
Might not
So
be
many,
much.
so many.
Yes, might not be
About
much.
3, 4, 5
Yes,
now.
So I do not know about, and then we have the primary healthcare centers.
Okay.
What you will complain is that they are not staffed because there is very limited data. I think, for me, I think there should be all the governors should look at hiring personnel into the healthcare system in their government.
I would like us to round up with this now. How can
Okay.
Nigeria better address the maternal and child health care challenges, especially in marginalized communities? You actually said your community is not marginalized from your statement. Uzeba is out of it. So how can
from
government...
Sabongidaura.
Sabongidaura, okay. So how can government now manage these marginalized communities?
It falls back to the personnel that are actually passionate about where they work and about what they do. First of all, there needs to be health insurance. When we talk about health, that's the first thing. There needs to be health insurance for everybody. It needs to be affordable. It needs to be, there's need for individuals to go out of their way and actually make sure that those who live and work for them live healthy. Mother and children are the bane of mortality in this country. In this 21st century, there shouldn't be any mother and child dying out of childbirth.
Okay.
But there's a lot of that.
Right.
There shouldn't be people dying from accidents. There shouldn't be people dying from stroke, CVA. That is very rampant. So those are the things that need to be in place. Health insurance, I think, is the most important thing. Government hiring capable hands into the hospitals and staffing the hospitals despite the Japa syndrome. And then equipments being there in the hospitals and individuals, you and I, playing our role, you know, making sure that, I'm sure you guys have health insurance in this facility.
Do. ITV do.
The ITV does,
yes.
okay. So I'm happy because that would be one of the few private entities who actually have health insurance for their staff.
You actually subscribed.
You're subscribed. Okay, you're subscribed. And that's fine. You know, the ability to be able to have it and subscribe and use it. Most people will say, I don't get sick.
So it's one thing to subscribe. It's another thing to use it.
Yes.
Thank you very much, Mrs. Victoria Omoamu.
Thank you.
For finding time. We'll still have you again so that we can provide solutions and chart a way forward as far as our healthcare system is concerned.
Thank you so
we
much.
sincerely appreciate you.